Have you ever realized that some foods are praised as superfoods, yet can quietly create problems for certain people? Garlic is a perfect example. For years, it's been known as a natural antibiotic, an immune strengthener, and a heart-friendly ingredient. And while much of that is true, a powerful food doesn't affect everyone the same way. For many seniors, garlic can be very beneficial. But for others, it may upset the stomach, thin the blood too much, lower blood pressure to unsafe levels, or aggravate issues like diabetes or kidney problems. Because garlic is used so widely in cooking, most people never suspect that their symptoms might be linked to it. At Senior Prime Life, our goal is to help you use natural remedies wisely and safely. So today, we're revealing 8 situations where garlic might actually be harmful, especially for adults over the age of 60. 1. People taking blood thinners. If you take medications like warfarin, aspirin, clopidogrel Plavix, or any anticoagulant, you must treat garlic with caution. Garlic is not just a flavoring. It acts like a natural drug in your bloodstream. It contains potent sulfur-based compounds, such as allicin and agone, which thin the blood. Researchers have shown that these compounds work similarly to prescription anticoagulants by slowing platelet activity and delaying clot formation. If you are already on medication to thin your blood, adding large amounts of garlic, especially raw garlic or supplements, can magnify the medication's effect. This increases the risk of internal bleeding, causes bruises to appear easily, and makes small cuts bleed longer. There have been cases where patients preparing for surgery experienced excessive bleeding simply because of their daily garlic habits. If you have a procedure coming up, surgeons recommend stopping garlic at least 2 weeks beforehand. You don't always need to eliminate it completely, but avoid raw garlic and never take supplements without doctor approval. 2. Pregnant women. While small amounts of garlic in cooking are generally safe, concentrated forms like supplements or large amounts of raw garlic require caution during pregnancy. Garlic contains compounds that can increase blood flow and promote uterine contractions. In normal circumstances, this might be uncomfortable, but during pregnancy, especially in the first and second trimesters, it can raise the risk of miscarriage or premature labor. Additionally, garlic naturally thins the blood. During pregnancy, when the body undergoes circulatory changes, excess thinning can be risky. For women with low blood pressure, garlic can intensify dizziness and fainting. Furthermore, garlic's strong sulfur compounds can worsen heartburn and nausea, which are already common in pregnancy. Doctors generally recommend cooked garlic in small amounts but advise avoiding supplements and raw remedies to keep both mother and baby safe. 3. People with low blood pressure. Garlic is praised for lowering high blood pressure by relaxing blood vessels. However, if you already suffer from low blood pressure, hypertension, this effect can be dangerous. Garlic can push pressure levels down too far and too fast. Seniors with low blood pressure who consume too much garlic may experience sudden dizziness, weakness, blurry vision, cold sweats, or fainting, especially upon standing. This happens because garlic's vasodilating effect reduces the pressure needed to pump blood to the brain. If you are taking heart medications, thyroid medications, or diuretics, garlic can intensify these effects, leading to a sharp drop in pressure. If you frequently feel dizzy or have chronic hypertension, it is safer to enjoy garlic lightly and cooked, avoiding raw forms or supplements that could cause a sudden crash. 4. People with kidney problems. If you have kidney stones or reduced kidney function, garlic can cause more harm than help. A major concern is oxalate content. Raw garlic contains oxalates which bind to calcium in the kidneys. For those prone to calcium oxalate stones, adding more oxalates can increase stone formation and flank pain. Seniors are especially vulnerable as their kidneys filter minerals more slowly. Additionally, the sulfur compounds in garlic can irritate the renal system in those with compromised kidneys. There's also a risk of medication interaction. Many people with kidney issues take diuretics. Because garlic affects fluid and electrolyte balance, It can amplify these medications, leading to dehydration or dizziness. If you have chronic kidney disease, CKD, or a history of stones, avoid raw garlic, garlic shots, and pills. Cooked garlic in moderation is generally safer. 5. People with diabetes. Garlic naturally lowers glucose levels by increasing insulin sensitivity. While helpful for some, it is a hidden risk for diabetics taking medications like metformin, glipizide, glyburide, or insulin. The combination of garlic and these drugs can push blood sugar dangerously low, a condition known as hypoglycemia. Symptoms include sudden dizziness, trembling, cold sweats, confusion, and fatigue. For seniors living alone, this can be life-threatening. The potency of garlic is also unpredictable. Raw garlic has a stronger effect than cooked, and supplements are even more concentrated. This inconsistency makes blood sugar control difficult. If you have diabetes and take medication, never use garlic as a daily remedy without medical guidance. Continuous hypoglycemia stresses the heart and brain. 6. People with stomach or digestive issues. For anyone with a sensitive stomach, GERD, gastritis, IBS, Crohn's disease, or ulcerative colitis, garlic acts as an irritant. The sulfur compounds that provide immunity benefits can be harsh on the gastrointestinal tract. Raw garlic is particularly aggressive. It stimulates stomach acid and irritates the gut lining. For those with acid reflux, this causes burning sensations. For those with IBS, it can trigger cramping, bloating, gas, and diarrhea by speeding up intestinal motility. Seniors with weak digestion often report feeling unsettled after eating strong garlic. It can also interfere with acid-reducing medications like omeprazole. If you have digestive issues, avoiding raw garlic and limiting cooked garlic can bring immediate relief. 7. People allergic to garlic. Garlic allergies can range from uncomfortable to life-threatening. Symptoms often begin subtly with itching around the mouth, a tingling tongue, or slight lip swelling. These are warning signs. As the allergy progresses, it can cause hives, runny nose, sneezing, or sinus congestion immediately after eating. For asthmatics, garlic can trigger wheezing. In rare cases, it can cause anaphylaxis, severe throat swelling, and a drop in blood pressure requiring emergency care. Allergies can develop later in life, even if you previously tolerated garlic well. If you experience itching, swelling, or breathing issues after eating garlic, stop immediately and consult a doctor. Safe alternatives for flavor include ginger, turmeric, and parsley. 8. People with bleeding disorders. If you have conditions affecting blood clotting, such as ulcers, hemorrhoids, frequent nosebleeds, anemia, thrombocytopenia, low platelets, or hemophilia, garlic can worsen your condition. Garlic naturally slows platelet activity, meaning blood takes longer to clot. For seniors, this risk is often overlooked until bruises appear easily or gums bleed. There are documented cases where daily raw garlic consumption worsened anemia and increased internal bleeding. If you have a history of bleeding disorders, or if simple cuts take a long time to heal, garlic may be the cause. It is crucial to consult your doctor, who may advise limiting or eliminating garlic to ensure your safety. Conclusion: garlic is incredibly potent, so much so that it works almost like a natural medication. But just like any medicine, it isn't suitable for everyone. If you deal with bleeding disorders, low blood pressure, diabetes, kidney concerns, allergies, or a sensitive digestive system, even small amounts of garlic may trigger unwanted side effects. For those who don't fall into these categories, garlic can still be an excellent, natural support for the heart and immune system. What matters most is understanding how your body responds and choosing the right form of garlic for your needs. Every health choice you make should help you stay strong, active, and independent. If you found this helpful, consider liking and sharing it with friends or family who regularly eat garlic. They may be using it without realizing the risks it could pose. At Seniors Prime Life, our goal is to guide you towards smarter and safer health decisions.